honest, the crowd is a bit overwhelming. Thank you so very much.
Enugu State's First Lady, Mrs. Nkechiyere Mbah, wraps up her tour of Enugu West Senatorial Zone with a bold vision to empower more women and children across the state. With compassion in her heart and purpose in her stride, Mrs. Nkechiyere Mbah, the First Lady of Enugu State, has concluded her familiarization tour of the Enugu West Senatorial District, bringing the message of hope, empowerment, and inclusive developments to the grassroots. The tour, which spans several communities and local government areas, wasn't just ceremonial. It was deeply personal. It was purposeful. It was about connecting directly with women, children, the vulnerable, and community stakeholders to understand their realities and to respond with lasting solutions. Every stop was marked by moments of joy, emotional testimonies, and promises of brighter future. Mrs. Mbah listens to the voices of rural women yearning for economic opportunities. She held hands with children dreaming of education beyond primary school. She sat with community leaders to discuss how health, skills, and empowerment can transform generations. With a signature blend of brilliance, empathy, and approachability, the First Lady unveiled new initiatives aimed at scaling up economic empowerment programs for women, including vocational training and small-scale enterprise support, scholarship drives, and back-to-school programs for children in underserved communities, healthcare access, especially maternal and child health education, and human capital development projects that prioritize sustainable impact over token gestures. Described by many as the mother of the new Enugu, Mrs. Mbah is fast becoming a national symbol of what modern First Ladyship should look like. Compassionate yet strategic, accessible yet visionary, ceremonial yet hands-on. From town halls to marketplaces, from school playgrounds to health centers, her message was clear. No woman or child should be left behind in the new Enugu we are building. Already, plans are underway to replicate and expand these outreach efforts in other senatorial zones as the Office of the First Lady partners with state ministries, NGOs, and international development agencies to reach even more beneficiaries. Best First Lady in Nigeria? Many are calling it already. With her deep warmth, sharp intellect, Mrs. Nkechiyere Mbah is redefining what it means to serve not just beside a governor, but directly in the hearts of the people.
This familiarization visit presents a vital opportunity to connect with you and truly understand your unique challenges and aspirations. As the First Lady of Enugu State, my role is one of service, championing causes that affect our families, women, children, and communities. Hence, I have come to listen, learn, and extend my support. Together, we must work to eliminate social, economic, and cultural barriers that prevent our women from succeeding. I am dedicated to supporting all skill acquisition, maternal health, gender-based violence prevention, and access to education. No woman should be left behind. I am committed to championing initiatives that empower women, enhance their skills, and provide platforms for their voices to be heard. Let me also express my appreciation to the local government chairman and their exceptional wives. Your tenacity and focus are inspiring. As I live here today, I carry with me your voices, your concern and dreams, and I promise they will shape the programs and policies we pursue. Thank you all. Thank you.
Your Excellency, on behalf of Enugu West, we thank you very much for finding time to come and familiarize yourself with us.
To Akamori from
Just when you think you've seen the peak of progress, another bold wave of transformation rose through Enugu State, driven by the unwavering vision of Governor Peter Mbah. Today, the skyline of ESUT Teaching Hospital, Park Lane, is being dramatically reshaped. Towering multi-storey structures are rising rapidly, each brick laid not just in concrete, but in purpose. These buildings aren't just physical structures, they are symbols of a new era in healthcare, a revolution taking roots in every corner of the state. At the core of the transformation is a comprehensive overhaul of Enugu's entire healthcare ecosystem. Governor Mbah's administration is rolling out an ambitious multi-tiered plan that leaves no community, no local government, and no citizen behind. At the grassroots, 260 brand new Type 2 primary healthcare centers, one in every ward, are under construction across all 17 local government areas. These centers are designed to bring essential health services right to the doorsteps of the people, bringing long-standing gaps in rural access to care. Mid-tier Type 3 healthcare centers in each of the state's 3 senatorial zones are undergoing full upgrades. Modernized infrastructure, new equipment, trained staff, all engineered to deliver efficient and quality secondary healthcare services. At the apex, the vision is nothing short of global. The construction of 300-bed Enugu International Hospital, a state-of-the-art facility envisioned as a medical tourism hub for the entire West African sub-region. Here, cutting-edge treatments, specialist care, and advanced diagnostic services will converge under one roof. To complement this medical infrastructure boom, the administration is also investing in human capital development, revamping the state's University of Medical and Applied Sciences, SUMAS, Ibueno, to become a center of academic and clinical excellence, nurturing the next generation of doctors, nurses, and researchers. And now, ESUT Teaching Hospital, the flagship of tertiary healthcare in Enugu, is being repositioned to reflect the state's new healthcare standards. The hospital is undergoing a complete facelift with new clinical buildings, improved learning facilities, and a streamlined operational structure to meet both patients' care and medical education demands. From the village clinic to the specialist surgical theater, Governor Peter Mbah is building a healthcare ladder where every rung leads upwards towards quality, accessibility, and dignity in treatment. This is not just reform, it's a total system renewal, and it's placing Enugu on the map not only as a destination for care, but as a model for how public healthcare can and should work.
Going on at the same time in this street. The one just behind me is the laboratory support service complex. It's a two-winged complex. So one part, the laboratory services will be in one, the other support services like the pharmacy, the radiological services. And underneath that, you see all those spaces will be parking lots. It's a common place when it's finished. All the laboratory services, pharmacy, radiological services, they will all be contained here. You know, all the services have been going on at the lowest level in Parkland right now because of space challenge. Right now, by the time this particular building is finished, we will now begin to offer such services at tertiary level, not at the current level. Thanks to His Excellency, we will now actually find our feet and pride of place as a tertiary institution, ESUT Teaching Hospital, building that is almost near completion at gate. That is the triage area. Triage is where, when a patient comes in emergency, you are able to sort out the patient within 30-45 minutes. You say, this is a surgical emergency, this is a medical emergency, this is a case that can go and come back the next day. So that is what the triage. There is another at the back of the institution. That one is for the College of Nursing Sciences. Another building? Yes, it's ongoing. Ongoing. 6 to 8 months, not